Hello, my name is April Baller. I work in the WHO Health Emergency Department as the focal person for infection prevention and control. As we have already learned in Module 2, WHO has released a practical guide for UN country teams, known as the Operational Planning Guides to support country preparedness and response. This guide is intended to provide immediate support to governments and partners in implementing their COVID-19 country plans. This will be operational from now until the 30th of April. The country guidelines are structured along 8 key pillars of public health response. Pillars are operationalized by actions to be taken to enhance country preparedness. The focus of today is Pillar 6, Infection Prevention and Control in Health Facilities. With this video, we will describe the actions to be taken within this pillar. This is relevant at country or sub-country level for governments, UN country teams, and partners. The goal is that, after watching this video, you will be able to conduct your own assessment using the WHO online planning tool for COVID-19. In Module 2, we presented high-level actions and recommendations of Pillar 6, namely in relation to IPC best practices in communities and health facilities. Now, let's take a deeper look at these practices. There will be 3 levels of preparedness starting from basic, level 1, to sustainable, level 3. At first level, countries should assess IPC capacity at all levels of the healthcare system, national, regional, and facility level. This includes public and private facilities, pharmacies, and traditional practices. At healthcare facility level, minimum requirements include a functional triage for early detection, isolation capacity, trained staff, and adequate IPC supplies such as PPE. Hand hygiene stations and wash services are also essential. Where risk of community transmission is high, it is necessary to assess IPC capacity in public places and community spaces. Where available, review and update the National Healthcare IPC guidance accordingly. If not available, establish an IPC task force to develop interim guidance. This guidance should define a patient referral pathway as well as recommending an IPC focal point at national and acute facility level. Community guidance should include specific recommendations on IPC measures and referral systems for public places such as schools, markets, and public transport. With respect to healthcare personnel, a plan should be put in place to monitor exposure to confirmed cases of COVID-19. Additionally, all countries need a national plan to manage PPE supplies, stockpile, and distribution. This needs to be coordinated with the operational supply and logistics team. At second level, key actions include 1. Engaging trained staff with both the authority and technical expertise to implement IPC activities. 2. To prioritize based on risk assessment. And 3. To understand local healthcare seeking behavior. Countries should record, report, and investigate all cases of healthcare-associated infections and disseminate IPC guidance home and community care providers. Selected facilities will need to implement triage, early detection, and infectious source control, also known as isolation. Visual alerts, for example, educational material in appropriate language for family members and patients to inform triage personnel of respiratory symptoms can be implemented. This is also good ethic of respiratory symptom. Administrative and engineering control measures such as ensuring appropriate ventilation systems should also be established as part of controls required at facility level. Lastly, support access to water and sanitation for health, known as WASH, services in public places and community spaces most at risk. Third-level actions include monitoring IPC and WASH implementation in selected healthcare facilities and public spaces using established protocols such as the Infection Prevention and Control Assessment Framework, the Hand Hygiene Self-Assessment Framework, Hand Hygiene Compliance Observational Tool, and the Wash Facility Improvement Tool. Tailored support to healthcare facilities based on IPC risk assessments and local care-seeking patterns is also recommended. Lastly, but not least, training should be put in place to enhance healthcare workers' skills and competencies. Now that you have watched this video, you should be able to describe each action in IPC and be ready to assess whether each has already been or needs to be implemented at country or sub-country level. It is important to keep in mind that the actions presented in this video are a guide and should not supersede existing national guidance and plans. It should be used to rapidly adapt existing relevant national plans and accelerate preparedness. For more information, you may access the Operational Planning Guidelines in the Additional Resources section of the training platform. You are now ready to begin the assessment using the WHO online planning tool for COVID-19. Thank you for watching this video.